Hi, my name is Chris. I'm a third-year psychiatry resident, and I'm from Virginia. I chose Montefiore to train as a psychiatry resident for a number of reasons. I think first and foremost, I wanted a program that really valued both the psychotherapy component to psychiatry as well as the sort of neurobiological component of psychiatry. From that point, it really came down to the interview day. When I got here, this sort of felt right to me. I liked the people I met. Everyone was really friendly. I'm a PGY3. I finished my PGY2 year last year. I really liked our addiction psychiatry rotation. I didn't know a whole lot about addiction, psychiatry, and sort of the ravages of addiction on people's lives, and I got to see it in kind of a shared care format, primarily as a consult service in the hospital. So we sort of entered people's lives to really discuss sort of their darker moments and their addiction, and we could really provide help for them sort of very quickly. It also spurred a research project that I got started in at the hospital that sort of, it's ongoing, and right now we're making sort of system level changes to how we treat alcoholics here in the Bronx. So I think both the knowledge of the attendings, the patients that I got to treat, and how I sort of was able to think like a scientist on that rotation really sort of excited me about it. Lecture day at Montefiore, we call it Didactic Day. So it's a day in the week, Thursday, in which all the residents of all the years meet. We have lectures throughout the day that are sort of designed to meet us where we're at in our residency training. So for example, this year I'm in the outpatient department, so there's a lot of lectures sort of focusing on psychotherapy, sort of how to become a psychotherapist. And I really value the day because, in fact, when I was looking for residency, I really wanted to find one that was really invested in the residents, and devoting a whole day to teach is a huge thing, and it's extremely helpful. I think it's really one of Montefiore's strengths. From when I started as an intern, not knowing where I was, what I was doing, not knowing a whole lot about psychiatry and psychopathology, I felt very well supervised from my first day on our inpatient unit. And then as I've gone along through my second year in the subspecialties of psychiatry and over at the state hospital, I've sort of got more independence, but also if I needed a really knowledgeable, friendly, supportive person to look up to and get help from, they were always there. When I'm on call, if I need something, I just pick up the phone and call, and I always sort of get very responsive attendings, so supervising me. Now in the outpatient department, I have multiple supervisions for the different psychotherapy modalities, for psychopharmacology, and it's similar. It's really a give and take. It's my own comfort and my own independence with, if I need the help, it's there. So I would say the faculty's supportive, friendly, knowledgeable, and at the end of the day, really, I can really tell that they care about me developing into my own person, my own psychiatrist. I got involved in a research project kind of fortuitously. I was on the addiction psychiatry rotation as a second year, and I was getting multiple consults on patients with alcohol use disorder who were coming in intoxicated or in withdrawal, and their primary teams weren't giving them a medication that we felt was very safe, highly effective, evidence-based, and we wanted to think of a system-level change that we could make to Montefiore instead of every single consult recommending the same kind of treatment to each patient. So that was sort of the idea. So I spoke with my attending, who then sort of referenced me to the quality improvement person at the hospital. I reached out to them. We put together this project, and right now it's interesting. We're like sort of right in the middle of the project. We've made the system-level change. We're seeing that the care we want to provide the patients, the primary teams have made the change through word of mouth and through the changes we made to the system. So it's exciting that I didn't think a resident could make such a broad impact on a large hospital system, but I was able to do that here at Montefiore. I can't speak more highly about the living situation. I live in Montefiore housing on Waldo, so that's in Riverdale, which is a middle class to upper middle class section in the guess, northwest part of the Bronx. There's a shuttle that runs every morning and every afternoon, I think 3 times each, to the hospital and back. I have a car because I'm from Virginia, and if you don't have a car, you don't have a life, so it's just kind of inbred in me. And so I drive every day. I can find parking on the street, it's no problem. It's a 2-minute walk to the 1 train, which gets me down into Manhattan if I want to go down to the city for something. I'm right by Van Cortlandt Park. I run in it every day. It has a golf course, which I haven't yet played in, but I'm at some point going to. I trained in sort of a rural suburban setting in Virginia where there was sort of flatline socioeconomic status, similar psychopathology. And so I was sort of really thrilled when I came to the Bronx to see sort of all levels of psychopathology, people that had severe mental illness, that were struggling at home, struggling in their relationships, to people that were more higher functioning, sort of, I guess, more neurotic pathology. It really, like I said, kind of runs the entire spectrum in the Bronx.